Hi everyone, I want to talk to you about headache. Headache is common. I've had headache several times. You must have had headache. Let's go. I have a headache, but what is the cause? That is the question. Can we provide an answer? Let's see. Okay. The differential diagnosis of headache could be primary headaches. There are three of them, and they are migraine, cluster, tension type headaches. Those are the three primary headaches. But headache could be caused by common monocyte poisoning. The history will give a clue to that. Whether it is wintertime, the furnace is giving problem in the house, or somebody is locked up in the garage and turns the engine of the vehicle on, and so on and so forth. Cold stimulus. A lot of people take ice cream in summertime. Now they have brain freeze. Toothache, check them out for dental caries. Sinusitis, I made a separate presentation on sinusitis. You can have it checked. Subarachnoid hemorrhage, that's the worst headache of my life. Meningitis, when there's fever, stiffness, and you, know, you just know that this is meningitis. Encephalitis, hemicranial continuous, similar to cluster headache, and could be treated with indomethacin. Could be brain tumor, particularly presenting with more trouble, more headache trouble early in the morning. And the individual could have had seizures as well. Commoner, and you could be more suspicious in anybody greater than 50 years old coming down with headache for the first time and presenting as trouble early in the morning, plus or minus seizures. Could be trigeminal neuralgia or post-herpetic neuralgia, and giant cell arteritis in someone who is having ischemic states, mostly elderly person with autoimmune underlying. Um, Here you have to act fast because you need to prevent blindness here. Could be glaucoma, mostly angle closure. More history will give clue to that, or optic neuritis. Could be as a result of intracranial hypertension or pheochromocytoma, where the headache will be sudden with heart rate and sweating, and the BP will be on the high setting. Could be as a result of excessive exertion. Menopausal women will have headache and flushing. When you have taken coffee in a large amount, or you are not used to coffee, caffeine can give you headache. If you are anxious, or you are under too bright light, or you've not had a good sleep, or you've been abusing analgesics, you can have analgesics-induced headache. When you are depressed, or you are on study medications that the part of the side effect is headache, you can come down with headache. There are specific situations and specific interventions. Primary headache, like I've mentioned just a while ago, could be migraine. I will have a detailed presentation on migraine very soon. Could be cluster headache and tension type headache. I'll talk about them separately in future presentations. They account for 90% of headache presentations at clinics and emergency room. The primary headache. So subarachnoid hemorrhage should be uh, taken seriously. Why? It's an acute emergency requiring CT or lumbar puncture. And of course, you refer to the neurosurgeon quickly for immediate surgery. The presentation will be that the individual will complain of headache and the worst headache of his or her life, or some will describe it as thunderclap, and so on and so forth. Giant stress arthritis, like I said, mostly in elderly, ischemic history, autoimmune history. You give high steroid. If not, the individual can come down with blindness. Carbon monoxide will give a clue about the history. The history will give a clue. Like I've said it, the furnace in wintertime or locked in the garage with the engine of the vehicle turned on. Blood samples for carbon monoxide will reveal. The main treatment here is to give oxygen. If you suspect glaucoma or you are sure it's glaucoma, refer to ophthalmologist immediately. You don't need to toy with those eyes. Early morning headache and greater than 50 years old in age, do CT scan. Why? Could be brain tumor. Glycosamine for trigeminal neuralgia and postherpetic neuralgia. Nowadays, we know carbamazepine for many reasons, including seizure treatment, but it was initially manufactured for this purpose. Yes, for this purpose. Menopausal women to be assisted with non-pharmacological measures. It's not all the time we load them with pharmacological agents. So let them do everything. I will have a separate presentation on premenopausal and menopausal state in women very soon. But they can just be dressing in double layer, get fan, drink cold stuff instead of hot. Don't drink too spicy or take too spicy stuff. Then some can take hormone replacement therapy, and some can take non-hormone replacement therapy like clonidine, vaccine, and the rest of them. So there is a way to help them out without hormone replacement therapy. Or if the individual is okay with hormone replacement therapy, you can go. Well, there will be self-representation on that. So don't let me take all the time because of that right now. In conclusion, we have not exhausted possible causes of headache, but those ones that I've listed are the major ones. But I will still go over each cause in detail later, like migraine in detail, cluster in detail, tension type headache in details later on. So you can watch out for all those presentations. What I've been able to do right now is everyone at a point in time, you must have had headache. So it might be something mild and it could be serious. Let's get to the bottom of it. There was an elderly woman who had headache, walked to the clinic, and the history was taken, and the doctor placed on acetaminophen, and she went home, but later on started having seizures. Rushed to the emergency room. They did CT scan. Lo and behold, she was having brain tumor. That is why this presentation is significant. You cannot overlook anything at any time. Thanks for watching. Please subscribe. Thanks.